Good afternoon. My name is Han Yu. I'm the Chief Learning Officer from the California Endowment, a member of the Roundtable, and I'm honored to be the moderator for this last session of a wonderful two-day workshop. What an incredible 2 days. There have been so much learnings, and I went, like Ray Baxter this morning, to pull several threads that I think are really powerful that should be woven into this session. And there are 4 of them. One is that Aditya Vidya did a beautiful job of framing really for the whole 2 days when she did the definition of how do we define community power. And this is with our colleagues at USC Equity Research Institute, where the emphasis is on making sure that we focus on communities most impacted by structural inequality, and that we develop and sustain the organized base of people in order for them to act together to promote democratic structures and so on. So wanted to just make sure we refresh our definition of this. And then secondly, Ai Po's words in her keynote really stayed with me, just in terms of her saying that whether we are talking about the future of health, the future of care, and the future of democracy in this country, we have to put at the forefront the people of our system have failed the longest. They hold the solutions. If they get power, it benefits all of us and leads us towards the future we deserve. And finally, Tony Aiton talked about how the California Endowment went from being technocratic to democratic. These are what we've learned over the years, over many decades, actually. And I wanted to share this wonderful framework that Paul Spear and his colleagues presented that really does reflect our journey from thinking about the medical model to the social determinants of health model that increasingly looked at context, community capacity, and that zip codes matter, and then going even more upstream to think about the root causes of structural inequality that are shaped by macro, social, political, and economic causes of inequities. So let me also talk about the words of Hari Hanh and how she reminds us that researchers, evaluators have the responsibility of who, what, and how we shine light into what end. Especially our goal should be to sharpen practice and make visible the work to enable learning, and then share that learning. And then probably most importantly, we have a responsibility to put power, race, and inequality at the center to recognize the uncertain dynamic context within which the community acts. So the goal of this session then is to really think about how does the evidence help us to to make better policy and funding decisions. It's not a question of if we should support community power, but how do we better support community power building to achieve racial and health equity, and do it with humility. We know that the research and theory that link community power and health equity is nascent, and that that largely the conceptual framework is that the data and research is largely conceptual rather than empirical. So in order for us to build long-term, sustainable, lasting power infrastructures to support the work of our communities, we as funders need to invest more and partner better with each other. And yet there's still a lot of skeptics out there. So our goal then is to make sure that we really look at the empirical evidence base and link community power, with health equity, and draw the implications for knowledge and practice as well as research to support power building. And so I'm so pleased to and honored that our presenters have accepted to be part of this panel. You'll find their wonderful and impressive bios in the attendee packets, but I want to just share quickly. Paul Spear is from Vanderbilt University, and he'll talk about the challenges and tensions in the exercise of community power and draw the practice implications for research. We have Tia Martinez from Forward Change, and she will talk about some of the powerful lessons learned from building healthy communities, and also talk about the role of funders and what we need to be thinking about. Bill Wright from the Center for Outcomes Research and Education and Providence Health and Services will be talking about really testing the theory of change. How do we link power with what Tony mentioned as the ABCs, power with policy systems change, with the change conditions that lead to longer term health outcomes. Teresa Cutts is under faculty from Wake Forest University School of Medicine. She'll be talking about the Memphis model of cardiac disparities case study and thinking through the lens of community power and health equity. And then finally, Laura Perrion will talk about practicing community-based participatory research in the time of COVID. And so before we get started, we'd love for you to get to know the panelists a little bit better. So I'm going to just go around real quickly, round robin, and ask you all, why are you personally passionate about the topic of community power? So I'll start with Paul.
Well, I think like most of us on the panel, we're very aware of the injustices all around us in the world, and the way that I can participate and act and try to make things better, I think, is by working as best I can to help understand community power and support groups that are really working to develop and exercise community power. So that gets me excited. So that's why I'm here.
Thank you, Paul. Tia, why is this so meaningful to you?
I think it's so meaningful to me because, like, all of my work is basically about trying to make meaning of my family and my community's suffering and survival. And when I look at all of the things out there, both the analysis of power, right, makes sense of why there's this unequal distribution of suffering, but it also is key to unlocking and healing from that. So that's what brings me to the work.
Great, thank you. And Bill, why is this meaningful to you?
I just really love how clear-eyed and fearless this work is. I think, you know, we hold so tightly to the way that our systems are built out. And even when we recognize that they're not working for everyone, we don't go first to changing them. We try to create programs, and maybe we try to alter the way some people move through the system, but we never sort of visit whether the sort of system itself is adaptive enough to the people that it needs to serve. And this is really a way, I think, for us to ask much more fundamental questions, much more fearless questions about not only how those systems need to be designed, but who needs to be making the decisions about how those systems are designed. I think we've sort of, we fall easily into some of these traps where sometimes we define them as systems failures, and sometimes that's true. Systems don't have bad intentions but produce bad outcomes. But we also have a lot of systems where they were actually designed with bad outcomes in mind for some populations. We've sort of conveniently forgotten it, and what we're seeing is actually the systems functioning the way they were originally designed. And so we need to kind of think a lot about whether bad intentions or not, who needs to be at the table where these systems are being designed, and the fearlessness of the power building work is in sort of embracing that conversation.
Thank you. And I'll go to Teresa next.
Thanks, Hanh. I'm drawn to this work like Tia because in my formative years, I grew up in the mean Mississippi Delta. And I fell in love with the people there that worked hard, that lived in terrible, deep poverty, all hardworking people that lacked traditional power, money, status, higher education, including my ancestors. My twin sister and I were born in a clinic about 500 feet away from where Fannie Lou Hamer, the civil rights activist, is buried. And as I watched as I was growing up, I'm about 61, the African-American children coming in, being integrated into our schools, and the unkindness and hatred and abuse that they suffered, and tried to undo some of that with kindness and respect and humility. And I also had an unusual experience as a white majority child growing up. My grandmother had a dry goods store in a predominantly African-American part of town. And every Saturday, from being a toddler to a teenager, we would go and help in her store. And I developed a very deep respect for the African-American culture and appreciation of the authenticity, the warmth, the kindness, deep community power there, but I saw their abject poverty. I saw people's fingers swollen up like Mickey Mouse gloves from picking cotton, and how they would bring these little meager quarters from working 6.5 days in these hard, sizzling Delta fields to get a little bit of joy, and they transcended that existence. And then my ancestors were, one of my grandfathers was a sharecropper. So I've always had this sort of fire in my belly for social justice, although I didn't know what it was called when I was a kid, and that desire to kind of flip that power differential, or at least flatten it.
Thank you so much. And Laura.
Thank you.
Hi, mine is just super short. I just have like Cornel West said, love is the steadfast commitment to the well-being of others, and social justice is what love looks like in public. So to me, I'm driven a lot by love and by service, and empowerment and community power is part of that. So that's what drives me.
Thank you so much. And I just also want to share, I come emboldened by where I came from as a refugee to this country, and the legacy of the devastating Vietnam War and what we're still trying to live through in terms of the colonialization.